Hey there, fellow nurses! Welcome back to Nurses Insiders, the YouTube channel dedicated to all things nursing. Today, we're diving deep into a topic that's close to all our hearts: the crucial role we play in the care of diabetic patients. As nurses, we know that our rounds are more than just a routine task. They're a lifeline for our patients, especially those with complex conditions like diabetes. So grab your coffee, get comfy, and let's explore the ins and outs of diabetic care, highlighting the power of those regular check-ins that can make all the difference. Imagine this. It's the middle of the night and your patient, a diabetic, is sleeping soundly. On the surface, everything seems fine. But what happens if their blood sugar drops dangerously low? What if they need immediate medical attention? This is where our vigilance as nurses comes into play. Regular rounds, those consistent check-ins on our patients, are not just about following protocol. They're about ensuring our patients' well-being, catching potential problems before they escalate, and providing timely interventions that can truly be life-saving. In this video, we'll follow the journey of a diabetic patient and witness firsthand how a nurse's attentiveness during rounds becomes the critical factor in preventing a potentially dangerous situation. All right, before we jump into the action, let's make sure we're all on the same page about what diabetes actually is. In simple terms, diabetes is a chronic condition where the body either doesn't produce enough insulin or it can't effectively use the insulin it does produce. Now you might be wondering, what's insulin? Well, think of insulin as a key. It unlocks the doors to our cells, allowing glucose, which is sugar from the food we eat, to enter and provide energy. Without enough insulin, or if the insulin isn't working properly, glucose can't get into the cells, and it builds up in the bloodstream. This can lead to a whole bunch of health problems if left untreated. Think of blood sugar, also known as blood glucose, as the fuel gauge in your car. It's a vital indicator of how well your body is functioning. Just like a car needs the right amount of fuel to run efficiently, our bodies rely on the right amount of glucose in our blood to perform optimally. When our blood sugar levels are balanced, we feel energetic and our organs function properly. However, just like your car needs the right amount of fuel to run smoothly, our bodies need the right amount of glucose in our blood. Too much glucose, like stepping on the gas too hard, can put stress on our system. This is called hyperglycemia. Hyperglycemia can lead to serious health issues if not managed properly, such as damage to the eyes, kidneys, and nerves. On the other hand, too little glucose, like running on empty, can cause our systems to sputter and stall. This is called hypoglycemia. Hypoglycemia can make you feel shaky, dizzy, and even lead to loss of consciousness if not treated promptly. And that's where regular blood sugar monitoring comes in. By keeping a close eye on our blood sugar levels, we can make sure they stay within a healthy range. It's like checking your fuel gauge regularly to make sure you're running at the optimal level. Regular monitoring helps us catch any imbalances early and take corrective action. For our patients with diabetes, this monitoring is crucial because it helps us determine if they need adjustments to their medication, diet, or activity levels to keep their blood sugar in a healthy range. By doing so, we can help them avoid complications and maintain a better quality of life. Now, let's circle back to insulin. As we mentioned earlier, insulin is like a key that lets glucose into our cells for energy. For people with type 1 diabetes, their body doesn't produce insulin at all. It's like they're missing the key altogether. That's why they need to take insulin injections or use an insulin pump to deliver that essential hormone into their bodies. For people with type 2 diabetes, which is the most common type, their body may not produce enough insulin, or their cells may become resistant to it. It's like the key is either worn out or the lock is rusty. It's a typical evening in the hospital, and our nurse, let's call her Sarah, is doing her rounds. Among her patients is Mr. Jones, a kind, elderly gentleman with type 2 diabetes. Good evening, Mr. Jones. How are you feeling this evening?
Well, Sarah, I'm feeling a mite tired, but otherwise I reckon I'm doing all right.
Sarah knows Mr. Jones well. He's a frequent flyer in the hospital, and they've developed a good rapport over the years. She knows he enjoys a good chat, but she also needs to make sure she gets through her rounds efficiently. As Sarah talks with Mr. Jones, she's also observing him carefully. She checks his vitals, asks about his pain levels, and makes sure he's comfortable. "Did you manage to eat your dinner, Mr. Jones? I know you weren't too keen on the chicken tonight."
Oh, I ate enough of it, dear. Didn't want to be rude, you know. Besides, got to keep my strength up. He chuckled softly.
Sarah smiles, knowing that Mr. Jones is a stickler for manners. She notices a half-eaten container of fruit salad on his tray. "Well, that's good to hear. Did the fruit salad tempt you at all? It looked delicious." She made a mental note to let the kitchen staff know that Mr. Jones was struggling with the main course. Mr. Jones's blood sugar was checked before dinner, and it was within the target range. Sarah makes a note of this in his chart. He seems stable, no signs of hypoglycemia. She knows that even though his blood sugar was fine a few hours ago, it's important to remain vigilant. Blood sugar levels can fluctuate, especially in patients with diabetes. "All right, Mr. Jones, it's almost time for me to head out. Is there anything else I can get you before I go?"
No, I think I'm all set, Sarah. You're a real peach. Get some rest, you hear?
Sarah finishes her rounds and heads to the nurse's station to complete her charting. She can't shake the feeling that it's too quiet tonight. The usual beeping of machines and hushed voices seem muted. Little does she know that this quiet night is about to be interrupted, and her commitment to her rounds will make all the difference for Mr. Jones. A few hours later, as the first hint of dawn peeked through the hospital windows, Sarah began her early morning rounds. The floor was still quiet, but a sense of urgency filled her as she approached Mr. Jones's room. "Mr. Jones, it's Sarah, your nurse. How are you feeling?" There was no response. Mr. Jones lay unusually still, his chest barely rising and falling with each shallow breath. Sarah's years of experience sent a jolt of alarm through her. Something wasn't right. Sarah immediately sprang into action, her training kicking in. She quickly checked Mr. Jones's pulse. It was weak and thready. His skin felt cold and clammy to the touch. His pulse is weak and he's clammy. Could this be? Remembering that Mr. Jones was diabetic, Sarah's mind raced. Hypoglycemia, of course, it could explain his sudden deterioration. She grabbed the glucometer from her cart and quickly checked his blood sugar. The reading confirmed her suspicions, 59 milligrams per deciliter. Sarah knew she had to act fast. Untreated hypoglycemia could lead to seizures, coma, and even death. Time was of the essence. "Get me an IV kit and a 50% dextrose solution, stat, and page Dr. Smith, tell him we have a possible hypoglycemic emergency." Within moments, the nurse aide returned with the supplies. Sarah wasted no time in starting an IV line and administering the dextrose, a concentrated sugar solution that would quickly raise Mr. Jones's blood sugar. As the dextrose flowed into Mr. Jones's bloodstream, Sarah kept a watchful eye on his vital signs. Minutes seemed like hours as she anxiously waited for a response. Slowly but surely, she began to see signs of improvement. His breathing deepened, and his color began to return. After what felt like an eternity, his eyes fluttered open, unfocused at first, then gradually regaining their familiar sparkle.
Sarah, what happened?
"Don't worry, Mr. Jones. You had a little dip in your blood sugar, but we're taking care of it. You're going to be just fine." By the time the breakfast trays started arriving, Mr. Jones was sitting up in bed, sipping on some juice and chatting with Sarah as if nothing had happened. His blood sugar had stabilized at 85 milligrams per deciliter. He was back from the brink, thanks to Sarah's vigilance and quick thinking. That morning, as Sarah finished her charting, she couldn't help but think about what could have happened if she hadn't been so thorough during her rounds. Would Mr. Jones have slipped further into unconsciousness? Would he have? She shuddered to think about it. The smell of coffee and toast wafted down the hallway as the breakfast trays arrived. Mr. Jones, now fully alert and back to his usual jovial self, eagerly eyed the food.
Well, now that's what I call a sight for sore eyes. Could sure use a good breakfast after that little episode.
"I bet you could. The kitchen sent up some extra fruit for you this morning. They said you weren't too fond of the dinner last night." As Mr. Jones tucked into his breakfast, Sarah couldn't help but feel a surge of relief wash over her. The color had returned to his face, and his eyes twinkled with their usual good humor. The crisis had been averted. While Mr. Jones finished his breakfast, Sarah took the opportunity to talk to him about what had happened. She explained the dangers of hypoglycemia and how important it was to keep his blood sugar levels stable. "Mr. Jones, you gave us quite a scare this morning. Do you remember what happened?"
To be honest, Sarah, it's all a bit of a blur. One minute I was drifting off to sleep, and the next thing I know, you're waking me up. Felt like I was in a deep, deep sleep.
You were. That's what happens sometimes when your blood sugar gets too low. Your body doesn't get the energy it needs, and it can really knock you off your feet. Sarah used simple, clear language that Mr. Jones could understand. She stressed the importance of following his medication regimen, monitoring his blood sugar regularly, and recognizing the early warning signs of hypoglycemia. "Do you remember what we talked about, Mr. Jones? Things like feeling shaky, sweaty, or confused? Those can be signs that your blood sugar is dropping too low."
Yes, ma'am. You've told me all that before, but I reckon it just slipped my mind this time. Won't let it happen again.
I know it's a lot to remember, Mr. Jones, but it's so important. And remember, you're not alone in this. We're all here to help you. As Sarah tidied up Mr. Jones's bedside table and prepared his morning medications, she couldn't help but feel a sense of satisfaction. She had made a difference in his life that morning. Her commitment to her patients, her attention to detail, and her quick thinking had quite possibly saved his life. It was just another day on the job, but for Mr. Jones and for Sarah, it was a stark reminder of the critical role nurses play in the lives of their patients. A role that often goes unnoticed, but one that is nothing short of heroic. Mr. Jones's close call serves as a powerful reminder of the crucial role nurses play in the lives of their patients. Every day, nurses like Sarah are faced with critical decisions that can mean the difference between life and death. We are often the first line of defense, the silent guardians who watch over our patients, ensuring their well-being even in the quietest hours. Our vigilance never wavers, whether it's the middle of the night or the early hours of the morning. Our rounds are not just about checking boxes and following protocols. They are about truly understanding our patients' needs, both spoken and unspoken. They are about connecting with our patients, observing subtle changes in their condition, and intervening swiftly when necessary. This connection allows us to provide personalized care that can significantly impact patient outcomes. We are the advocates, the educators, and the caregivers who make a difference in the lives of our patients every single day. Our role extends beyond medical care. We provide emotional support and education to help patients and their families navigate challenging times. Imagine if Sarah hadn't been so diligent in her rounds that morning. Her attention to detail and commitment to her patients are what make her an exceptional nurse. Imagine if she hadn't noticed the subtle signs of Mr. Jones's deteriorating condition. Her quick thinking and prompt action were crucial in preventing a potential tragedy. The consequences could have been devastating. It is this dedication and expertise that highlight the indispensable role of nurses in healthcare, ensuring that every patient receives the best possible care. So, my fellow nurses, let's continue to embrace the importance of our rounds. Let's be present with our patients, listen attentively to their concerns, and never underestimate the power of a watchful eye and a caring touch. Every round is an opportunity to make a difference. Every interaction has the potential to save a life. And there you have it, nurses. Another insightful session to keep you informed and inspired. Another vital lesson from the front lines of healthcare, where every moment counts and every action can make a significant impact. Remember, our vigilance and dedication can truly be the difference between life and death for our patients. It's our commitment to excellence that ensures the best outcomes. The information shared in this video is for educational purposes only and should not be considered as medical advice. It's meant to enhance your knowledge and skills. Always consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment. Your health and safety are paramount. If you found this video helpful, give it a big thumbs up and let us know in the comments what topics you'd like us to cover next. Subscribe to our channel for more nursing insights, tips, and updates. We are here to support you in your journey. And don't forget to hit that notification bell so you never miss an upload. Stay updated with the latest in nursing. And as always, share this video with your fellow nurses. Let's spread the knowledge and empower each other to provide the best possible care to our patients. Together, we can make a difference. Let's continue to learn, grow, and support one another in this noble profession. Your dedication and hard work do not go unnoticed. Until next time, stay safe, keep making a difference, and remember, you are the heart of healthcare.